Now, the Hope for the Future Generations has called on stakeholders to unite and work to eliminate the disparities and inequities that create barriers to HIV testing, prevention, and access to HIV treatment in Ghana. Citing the UN 8 Dangerous Inequalities World 8-Day Report 2022, the Executive Director of HFFG, Cecilia Seno, noted that despite progress made towards the global AIDS response, it is still untenable that in 2021, an adolescent girl or young woman between 15 and 24 years old became infected with HIV every 2 minutes, and that 250,000 adolescent girls and young women were nearly infected with HIV, more than 80% of whom were in sub-Saharan Africa. She said that the increasing rate of new HIV infections, especially among the youth in Ghana, is alarming. Thus, in line with the national theme for World AIDS Day 2022, which is 20 years of multi-sectoral HIV response, accelerating progress to end AIDS, all hands must be on deck to address barriers and inequalities slowing the response to end AIDS. Now, the Director of Programs of HFFG, Nancy Ansa, joins us live with more particularly on the increasing rate of infections among the youth. Grateful that you could join us, Nancy. Many thanks for your time. What is accounting for the increasing infection rate among the youth?
Please, can you come again?
Well, so if you can hear me now, I'm only trying to find out from you whether we know what is accounting for the increasing rate of infection among youth.
I think when we look at HIV infections, as you cited the data that you have with you that we put out there, young women are susceptible. And one of the key things we have to look at is the ability of our young women to negotiate for safer sex. That is very, very important. And when we look at women and HIV, we realize that there are many inequalities that fight against women when it comes to HIV. And these inequalities are barriers. And to remove these barriers, we may continue to see this trend where young women are more in getting infected with HIV. So we have to look at the issue of safe-sex negotiation. We have to look at the issue of assertiveness for adolescent and young women, that they are able to assert their rights. We should also be looking at making healthcare available, especially friendly adolescent facilities or facilities that are friendly towards young people, so that young people can access healthcare also with ease that other segments of the population do.
Well, but the rate, if you look at the statistics, seem to be more in urban centers, sort of, isn't it?
Okay, so we have these rates, and so it means that in planning and designing, we also have to be looking at the urban centers. The urban centers, as you talk about, are cosmopolitan, and we may infer, though I don't have statistics before me to show that the young women we have here are diverse and may have a lot of exposure that young women or girls in the rural communities may not have to that extent as the urban young people have. So it is very, very important that in programming, we just don't do only a whole program and looking at only the national level, but then we are able to disaggregate, we are able to plan for segments by location and then by also age groups.
Well, but there's a campaign we've been on for quite some time. Why do we still have such large numbers of young people being infected with something that we've been talking against for over 3 decades now?
Okay, so this question calls for a deep reflection, on our continuous programming. In the past 5 years, in the past 6 years, we may have to look at how has our prevention education been. Are we keeping the momentum like we used to do in the past? Are we sending education to the young people through the media that they have access to? These things are very, very important to look at. A plan that is targeted towards young people in their own space, that they are able to engage, ask questions, come out with their fears, and that they are also able to be reached, with the necessary information to make an informed choice.
Okay. I'm grateful to you that you could join us. Nancy Ansa is the Programs Director at HFFG.